Hi, I'm Rob DeMarco, special correspondent for PTV. I've been researching addiction for several months, and now my continuing quest took me to California, where I was able to interview Dr. David Seck, the CEO of Promises in Malibu. Enjoy. Hi, I'm Rob DeMarco. I'm at Promises with Dr. David Seck, the CEO and psychiatrist of this facility. I'd like to thank you for your time and everything and spending a few minutes with me.
Oh, it's my pleasure to be here.
What is your program based on?
Promises is what's called an abstinent-oriented program, meaning that we believe that the best way to overcome an addiction is to stop using drugs and alcohol altogether. And so first and foremost, we're trying to encourage people to find the resolve through medicines, through psychotherapy, through Eastern medicine, to stop using drugs and alcohol. Secondly, Promises, really believes that people, when they leave treatment, need support. That it's very rare that someone's going to work out all of their problems during a short treatment period. And so we believe that getting that support is critical to their success. And that in addition to that, really healing from an addiction is about personality transformation. It's about people embracing new ideas about themselves and their lives, and that one of the ways to do that is through NA and AA and other 12-step recovery programs.
That's great. Well, I can honestly tell you that I've only been here for a few minutes, and it's very peaceful and serene. You give off a lot of positive, good vibes. I mean, this is one of the most relaxing places I think I've ever been.
Well, good vibes are an important part of treatment. There was a time where many people who worked in the addiction field felt that you needed to put people down who are addicts, kind of humble them, otherwise they wouldn't accept treatment. And Promises was really founded on the belief that it's when you invite people into your home, invite them into a setting that shows them that you respect them and value them, that they're much more willing to accept treatment and to get better. So the whole goal of Promises is to remove obstacles to people wanting to be in treatment by creating an environment that is restorative and healthful and that allows them to engage.
That's interesting, because you would think that it would be to build some. It would be to have somebody at the best that they could be, rather than, tearing them down like that.
Well, I think that frequently treatment programs, if you go back 30 and 40 years when they first started, were reflecting the biases of the society and often the attitudes of people's family and relatives, which is that the person with an addiction has been very disruptive, they've taken advantage of their families, they've wasted money, they've gotten into trouble with the law, and that by the time they get into treatment, many times the families are incredibly angry. But that doesn't help people to get better. That what helps people to get better is the belief that they can recover and that they can make a contribution and that they can be part of the human family.
How many years has your program been around?
Promises was founded in 1998 by Richard Robb, who was a recovering guy who felt that there was something lacking in a lot of the treatment programs. One of the things that AA says is that it's a program of attraction, that people get better through AA because they want to be there. But at that time, if you go back 25 years ago, very few programs were attractive. That is, they didn't have a philosophy and a perspective that welcomed people and said, we're going to take care of you. They were very confrontational, they were very denigrating, and so he said, I'm going to create a program that really embraces this spirit of welcome and of removing obstacles to treatment. Treatment has changed a great deal over the last several decades. If you go back 25 years ago, we knew very little about addiction, both at a medical level and also as a psychological level. Psychologists and psychiatrists as a group had very little interest in treating addiction through most of the 20th century. And part of that is a historical accident. Freud started his career treating addiction. He had come up with experiments to treat a friend of his who was addicted to morphine with cocaine.
Yeah.
Now those experiments were very unsuccessful, and it nearly cost him his career. But what it did was it set a precedent that addiction was somehow outside the scope of psychiatry and mental health. And that what's really happened over the last 25 years is that they've gotten closer again. And there's much more serious research, and there's much more serious understanding about how drugs affect the brain and how they cause a person who wants to stop using to feel compelled to continue.
That's interesting you brought up the whole Freud situation, because a number of months ago I saw a documentary. It was a 6-part series, and it was actually on addiction, and they mentioned that Freud with treating addiction, and it's strange that you would give up one addiction for another. It's like you're defeating the purpose of kicking the habit to give up one thing for another.
Well, at the time, there was not much appreciation for how addicting cocaine was. So in fairness to Freud, and even through much of the 20th century up until the 1980s, there was a recurring belief that maybe cocaine isn't as bad as we think. And Freud himself was a cocaine user, so he had a reason to minimize its risks. But if you look at cross addictions, what we see is that people who are predisposed to becoming addicted to one drug have 13 times the risk of becoming addicted to another drug than the general population. So cross addiction is a real phenomenon. If you've ever been an alcoholic, you're much more likely to become an opiate addict, and that part of that probably has to do with the genetics of addiction. That the genes that predispose toward becoming addicted probably affect systems other than just addiction. They may affect impulsivity, anxiety, and those things probably drive addiction to more than one drug.
Well, the interesting about that, about being predisposed to an addiction, I remember watching an interview with Eric Clapton, and he said his addiction didn't start with drugs or alcohol. It started with sugar. He goes, I was addicted to sugar and butter. He goes, I put it on bread or anything. And he goes, that's how I started to get, that kick, get that jolt. And he said that's how it started, and then he moved on to alcohol. But I mean, it's amazing how one thing can, put you on the road to addiction.
Well, what we do know is that people aren't equally vulnerable. In other words, that if you look at who becomes addicted, it's only about probably 1 out of 7 people who tries a drug that has a problem with it. A good example is cigarettes. Over 80% of the people who graduate high school have tried cigarettes, but only about 1 out of 8 actually becomes a regular smoker or a nicotine addict. And it's true for alcohol, it's true for cocaine, it's true for opiates, that many people can be exposed to these drugs who don't have the predisposition to become addicted to them.
That is true. I have friends and family members that are smokers, and a lot of them kicked it, and it took them till they were in their mid-50s. And I have a good friend of mine who started when he was about 15, and he stopped, and then he picked it back up again. But I myself have never been into cigarettes. That was just never my deal. I might have a cigar at a wedding or if somebody having a baby, but it was never my idea to pick up a cigarette.
Right, it was never an attraction for you.
Yeah.
Boy, that's the best thing I've ever had, I better have more of it.
Yeah.
But that is one of the ways in which people who become addicted are different. The person who becomes addicted to alcohol or cocaine often has a different experience of it than you or I might. And that they experience what's called craving, which is that having been exposed to that drug, they can't wait to get it again. And they become obsessed with getting against it. Even before they're physically dependent on that drug, their brain's hooked.
Because all it takes is that one time, that one taste of that drug, and then you're basically totally into it.
For some people.
What makes your treatment center so successful?
I think Promises has been successful because it appreciates the uniqueness of its clients. Promises treats a lot of highly successful individuals and their families. And you can't work with that population without recognizing and feeling the achievements that they may have created in their lives in spite of their addictions. And so part of the reason Promises has been so successful is that it's been willing to accept the clients that we receive for who they are and where they are in their lives. I think the other thing is that we're not trying to teach a dogma here. In other words, we recognize that people come with a range of experiences and beliefs, and so we're trying to help them through a lot of different mechanisms. So, to the person who doesn't believe they have a problem, even though they're addicted, they may not believe their drug problem is that bad. We might use a technique called motivational interview that focuses on helping that person explore, well, if you're not addicted, why are you here? Tell me what's happening in your life and how it would be different if you either did or didn't continue to use drugs or alcohol. For the person who has anxiety and withdrawal symptoms, we frequently use acupuncture because it seems to help with some of the withdrawal symptoms and some of the insomnia that occurs after withdrawal. So we have an Eastern medicine component that involves acupuncture, meditation, guided imagery, that seems to help a great deal. For smoking cessation, we use a combination of medicines, psychotherapy, and hypnosis because it seems to help with smoking cessation. So I think part of the way in which Promises has been uniquely successful is by developing treatments that are appropriate to our clients' problems and not saying everybody's going to get the same cookie cutter approach. All of our clients get individual psychotherapy, and all of our clients get family therapy because most of them are in relationships that have been disrupted by their problems with drug or alcohol. So that our clients are getting a range of traditional therapy in addition to these other interventions.
Yeah, and that's probably the best thing because you're not just treating the client or the person that's addicted. You have to also help the family members because they also have to know what's going on and what they can do.
Well, that's right. And family relatives go through a whole series of stages, when their relative is in trouble with drugs or alcohol. When their relative is on the streets using, they're usually terrified. They're afraid they're going to overdose. They're afraid they're going to get into a car accident and die. They're afraid that they're going to lose their job. So before a person comes into treatment, families tend to be very frightened and they're caught up in their fear and they're trying to rescue that individual. But as soon as that person goes into treatment, something happens because all of a sudden they're in a safe place. So all of that fear starts to recede, and then all of the anger they've been saving up tends to come out because they're angry because they've been irresponsible, they're angry because they're sick from preventable diseases, they're angry because they're abusive when they drink or use drugs. So what happens is they go from being very frightened often to being very verbal about how angry and resentful they are.
Do you think being very angry and being very verbal about it, do you think that sometimes will hamper, or is that very effective? Because if somebody's trying to get treatment, I mean, if you're coming right at them in their face and saying, you hurt me when you did this and you did that, you point at them and everything, and you stick it right to them, you tell them the truth like that, do you find that works, or does that hamper the moving forward and getting healthy and well and receiving treatment?
The answer is that at the beginning, it's disruptive. That the person who's just stopped using drugs is overly reactive to emotional stimuli, they're overly reactive to noises and sounds. They also have trouble processing information. They're not in a condition where they can listen to their relatives and know how to respond to it. So that usually, what we try to do is to get spouses, parents into their own therapy at the beginning because they are hurting. They have their feelings and we want them to talk about them, but we want them to wait before they hammer their relative with them. But it's just too soon. And we know that people who've been addicted to drugs and alcohol have problems with what's called working memory. They have problems planning and organizing information. And so when you come at them that way, they can't really respond. So you raise a very good point.
And plus, how would they know what they've done if they've been under the influence of a chemical?
Well, the answer is that they know more than they care to. That is that most people who use drugs know that they're screwing up and they're hurting people. But the compulsion to use is so great that they are willing to ignore what we would call normal empathy and feelings for others because the addiction is so compulsive.
So basically, they're willing just to cut off everything just so they can get whatever they need for their addiction.
That's right.
That's the main focus.
That's right. Over the last 10 years, we've been in an epidemic of prescription narcotic addiction. And that epidemic has been driven in part by the availability of these medicines. For a long time, doctors were very afraid to write prescriptions for OxyContin, hydrocodone, Vicodin, codeine. And what happened is that there was a big shift in the medical community, starting about 30 years ago, to try to treat pain differently. This started with cancer pain, that we were aware that we weren't giving people with terminal cancer enough pain medicine. And once we saw how helpful it was to people with terminal cancer, we said we shouldn't limit this pain medicine to only those people with cancer pain. We should use it for chronic pain in general. So all of a sudden, we trained doctors to be less afraid of using these medicines. And as a result, many more prescriptions were written, and that meant many more people got a taste of these drugs. And what we know is that the proportion of drug abusers, to a great extent, is directly related to how available a drug is. So by making the drug more available, by having people have more experiences with it, we inadvertently increase the number of people at risk to become addicted to prescription narcotics. And the single biggest increase in accidental overdose have to do with narcotics, usually in combination with other drugs. And so exposure clearly is one path that gets people started. I think that the other thing with prescription drugs is that because they're made in factories and they come from pharmaceutical companies, people erroneously believe that they're safe. And so the drug that might be safe, if it's taken in the recommended amount under the supervision of a doctor, becomes very unsafe when you're taking it recklessly on your own in combination with alcohol, pot, and sedatives. So I think that the public often thinks that because they're taking it out of a bottle that it's somehow safer than if they were buying it on the street, and that's just not true.
Well, it's got that MD label on it, so
that's right.
that makes it okay.
Pharmaceutical grade.
Yeah. When an addict enters your program, how long is it?
Well, the length of stay varies. We have two programs at Promises. We have a young adult program, which is in Los Angeles, and we have the program here in Malibu. In Malibu, we typically recommend that people stay a minimum of 31 days. And we want them to have time to get over their detoxification. Most of the people who come to us are dependent on drugs, so they have to go through a detox period. But when someone's being detoxified from drugs, they can't really benefit that much from psychotherapy and from working on their problems because they're so distracted by some of the discomfort. Now, obviously, we give them medications to counteract the withdrawal symptoms, and we're able to manage their discomfort. But even so, they're not getting a lot out of that first week in terms of psychotherapy. So that it's really only by the second week that they're really able to start benefiting from the groups, the classes, the individual treatment. And so we really feel they need that full 30 days to get anchored. But the truth is that many of our clients need to stay longer. They are in trouble with their families, they have problems with court cases pending, their work is not ready to allow them to come back, and so they need to work on those kinds of reentry problems, usually from anywhere from 2 to 6 weeks longer. And so, we see a wide range of length of stays, but the average stay is about 40 to 50 days, depending on it's very variable. Some people are able to return to work immediately. Other people, need more time in therapy and in speaking with their psychiatrist to get stable enough to return to work. So we don't have one answer, Sometimes people have to return to work because they're going to lose their jobs. And so it may not be an ideal solution, but it's the best of the two options that are out there.
Yeah, it's basically, hey, this is what you have to do. So we'll build the support system around it.
That's right. There's bad and there's worse, so we're going to do the least bad thing that we can for that person. What we see at Promises may or may not be indicative of the whole country, but let me share with you the trends that we're seeing. Day in and day out, alcohol is still king. 50 to 60% of our clients are alcohol primary, either they're alcoholics or severely abusing alcohol. So, and that hasn't changed. That's been pretty constant over the decades. What has shifted is that we see fewer people who have cocaine as their primary addiction, and many more people with prescription opiates as an addiction. So, if you were to have visited Promises in the 1990s, mid-1990s, probably 30 to 40% would have had cocaine as a significant problem. now it's probably 10%, and 25% are prescription opiates.
It's amazing how the tide has turned. They've gone from using the traditional drugs to now using what's in a bottle.
Well, I think it is striking, but it is a reminder that addicts have a relative preference for one drug over another, but they prefer drugs in general.
Basically, anything will do.
Yeah.
What do you think about the deaths of certain celebrities in the recent years, such as Amy Winehouse, Heath Ledger, Marilyn Monroe? Do you have any feelings on that? With them using prescription drugs rather than drugs in the past?
Well, I think that in most cases, these deaths were accidental overdoses. In other words, there's very little evidence that Amy Winehouse or Heath Ledger were actively suicidal. And I think it really points to the fact that these drugs are dangerous. That opiates do suppress respiration, so they shut down breathing. And if you combine them with alcohol, they're even more likely to shut down breathing. And if you combine them with sleep medicines and anti-anxiety medicines, what we call benzodiazepines, it makes that even more likely. And so the leading escalating cause of death among drug addicts is accidental overdose involving opiates. So I think that the first thing is that people need to be very careful about how they take prescription opiates, and they really should never be combined with medicines or drugs. I think the second question is how closely were they being supervised? In the case of Amy Winehouse, it's pretty clear that she had a lot of support from her family to try to get over her addiction. She had been in and out of treatment and was failing in treatment. It seems unlikely that any more could have been done for her. That her family was all over it. They were trying to help her, and it wasn't working. But what often happens is that with celebrities, they use their celebrity to get things from doctors that they wouldn't give other people. So I think that one of the questions is how closely were they being supervised? In other words, if Heath Ledger was getting prescriptions from a doctor, how often was that doctor seeing? And how closely was he being monitored? And did that doctor follow the same procedures for the celebrity that they would have followed for Joe Blow? Because what happens is that I think very often, because the celebrity says, well, I'm too busy to come in, or people will recognize me, doctors will make accommodations that they would never make for anyone else. So I think that the doctors are like other people. They get starstruck, and their judgment is often bad. So I think for doctors, I think the message is you've got to treat your celebrity clients just as though you would treat anyone else. You have to make sure that you're seeing them frequently, that you're getting collateral accounts about whether they're cooperating or not cooperating with their medicine. You have to give them the same warnings. You can't allow yourself to bend the rules because the person's a celebrity.
Do you feel there is a stigma in people coming for treatment with drugs and alcohol?
Well, that's a really good question. I think that there is a stigma, and that although that stigma is less than what it once was, that the stigma is still very great. That most people carry a certain amount of shame, and the public tends to believe that an addict is making a choice, that nobody forces them to shoot up, nobody forces them to take an extra drink. And so that the general understanding of our community is much less understanding of alcoholics and drug addicts than it is of other physical or mental disabilities. And so, unlike, if someone has cancer, they don't blame the person for having cancer. With alcohol and drug dependency, people frequently blame the person with the illness. They say, well, you made that choice. You were the one who had to have more drugs. Well, it's silly. That's not what happens at all. People with addictions are not having a good time. By the time they become addicted, most of the pleasure that we've gotten from the drug is over, and now it's just trying to avoid the withdrawals.
Yeah. Basically, if I don't have that drug or that drink, I'm gonna basically die. Like I really need it just to function.
That's right. And because of that, there's a lot of prejudice still. And so, the stigma attached to drugs and alcohol, although much less than it was a generation ago, is still there.
That's amazing, because you would think that this stigma wouldn't be there and people would be more welcoming in terms of having somebody go get treatment rather than pointing the finger.
Well, I think that the positive side of many celebrities coming out with their stories of their addiction and the fact that it's been in the media and people do recover from addiction is that it helps people to understand alcohol and drug dependency better. But I think it's human nature to be afraid of things that we don't understand. I'm old enough to remember when people with physical disabilities couldn't really leave their houses because there had been no accommodation and people were afraid, and it's taken 2 generations to move us to where we are today. Things are getting better, but most people are afraid of addicts. They feel that they're evil, that they commit crimes, that they're irresponsible. The person who drives drunk and kills someone should be prosecuted for it. But that isn't to say that's the total sum of that person as a human being.
You are absolutely right. Everybody makes mistakes and everybody does things that they have no control over. What do you think is the attitude towards teens with drugs and alcohol?
Well, I think teens are afraid of nothing and they want to experiment. Typical teenagers want to do what the cool kids are doing. And so if the cool kids are getting high, they're going to experiment with getting high. And we know that adolescence is the time when people are most likely to have their first drink, their first hit of pot, their first prescription narcotic. And all of the data shows that if you can delay it, the older that someone is when they have their first drink, the less likely they are to become an alcoholic. And the younger they are at the time of their first drink, the more likely they are to become an alcoholic. So a lot of parental education has to be about trying to help their kids to avoid drinking in high school and delaying that, because that's what's going to reduce their risk.
How do you feel about the following stars who have gotten treatment and have stayed sober? Such as the following: we have Robert Downey Jr., we have Ronnie Wood from the Stones and the Faces, and we have Eric Clapton.
Right. Well, I think that with most medical diseases, addiction is a medical illness, you get a range of outcomes. And I think it's important for the public to know that addiction is imminently treatable and that many people overcome it. They have long, stable remissions from drugs and alcohol. And so having these models and having people in the community aware that certain celebrities have overcome their addiction is really important, and it's critical. I think that what is difficult is that the sword cuts both ways, that when a celebrity gets treated and relapses, people say, I knew it was not worthwhile, they just didn't want to change. But the truth is that, a very significant proportion of people who go through drug or alcohol treatment will have to go through it more than once before they get it right. And so I think that I'm excited that there are people we can now point to and say, well, look, these people were party guys and look at where they are today. But I think that we don't want to oversell it, because there are going to be many people who are going to come through treatment who may do well for a year or 2 years or 3 years and then have a relapse. And so we don't want to say, you see, I was right. We want to say addiction is a disorder where people are at a high risk for relapse and that they need ongoing treatment if we're going to prevent them from slipping back.
That is very true. It's one step at a time, one day at a time. What do you think of, in terms of how drugs enter the United States from other countries? Do you feel that the anti-drug message has had any effect, we've gone from the just say no until today, how it's evolved?
I think that there's certainly a debate as to whether or not interdiction works. In other words, trying to stop drugs either at the border or by arresting dealers. Does that really take drugs off of the street? And I think the overwhelming evidence is not much. It may make them more expensive. It may temporarily disrupt or suppress drug availability, but that for the most part, drugs are in demand, and that attempts to stop them from coming into to date have largely been unsuccessful. So I think that we have to look at how do we message to our kids and how do we give them the tools so that they'll be less vulnerable to become addicted to drugs. So we've been fighting the war on drugs on the supply side, but I think that we should be spending those resources on the demand side. We know that kids who are involved in activities, kids who are involved in school, kids who are involved with their parents and their families are much less likely to become addicted than kids who aren't. So I think that there's a lot that we can do to help, older children and adolescents to make them less vulnerable to the allures of drugs.
It's all about providing that alternative. That is 100% true. I'd like to thank you for your time. I can't tell you what it's meant to me to sit here and speak with you. I can seriously let you know that I came from Boston and I would have taken 3 planes. I mean, I've learned so much today, and I am so honored that you would let me come here and check out your beautiful facility. I can't tell you how much that meant.
Well, I've thoroughly enjoyed the interview, and it was a pleasure taking the time to be